So I'm Matthew Welck, and I'm a consultant orthopaedic foot and ankle surgeon, and I'm based out of Stanmore Orthopaedic, which is one of the top 10 orthopaedic hospitals in the world. Orthopaedics is, I chose orthopaedics, firstly for my sake and for the patient's sake. So for the patients, it's a specialty whereby you can make a huge difference to their lives. So you have patients who come who are struggling with walking. In my specialty, foot and ankle surgeons, pain in the feet and ankles can be hugely debilitating. And you have patients that are walking with deformity, walking with pain, and you get them back walking pain-free. The opportunity to get them back walking pain-free. Or you can have patients, for example, who are unable to enjoy life. They can't do the sport or the golf or the tennis they enjoy doing, and you get them back enjoying life. So from a patient perspective, it's very rewarding. And from my perspective, it's firstly cerebral. So I get to, it challenges my brain in terms of trying to work out what's going on with some of the complex patients and complex deformities. And it's also very technical. So I'm a very practical person, and I enjoy the technicalities of operating. I'm very precise, and so for many reasons, I enjoy orthopedic surgery. So the most rewarding thing by far is seeing the patient journey. So it's seeing a patient come to me. They're suffering with pain or deformity or lack of function, and it's trying to work out as a team what it is that's bothering them and what they want to be able to get back to doing, and then working out what I can do to help them best get there. And then it's following that patient through the journey, and seeing them, whether it be surgical or non-surgical, getting back to a better level of function. That is by far the most rewarding. So when you receive a card from a patient, or a picture of a patient who's climbed a mountain who couldn't ever dream it possible, it's a huge rewarding aspect to the job, and seeing patients get back to their things they enjoy doing and the sports and recreations they enjoy. So I think the first thing they can expect is that I'm approachable and I'm friendly. I'm not one of these that's super authoritative and difficult to talk to. So I'll talk to you on a level, and I'll find out all of your symptoms and the things that are worrying you, and you can tell me absolutely everything about your issues. We will then I will then thoroughly examine you, and a lot of my patients say I'm extremely thorough, so I'll do a very thorough examination, go through all your imaging that you've got, request any imaging you might need, and then together we will sit down and come up with a plan. So it's I pride myself in having very bespoke plans. So a patient with an identical condition that has different needs and different wants might end up with different treatment plans. So I think that the treatment is very bespoke to the person and what they want to be able to get out of it. So for example, somebody who has big toe arthritis, who wants to be who really wants to wear high heels, or somebody who's desperate to get back to sport, their requirements are very different. So I'll make sure that we come up with a plan that enables you to get back to where you want to be able to get to. And then I think the other thing you can expect is high-level science. So I'm very involved in the science, very involved in research, and you'll get the most up-to-date treatments. I work at Stanmore Orthopaedic, where we are cutting edge in terms of what we do. And finally, I like to be realistic in terms of goals. So I will tell you exactly where I expect you to be at what stage, how many weeks it will take for your full recovery. So enable you to be able to plan. And a lot of my patients tell me exactly what you said was going to happen is what happened. And I think patients really respect the honesty, because then they can plan their lives accordingly.